In January, a federal court approved a settlement in a lawsuit intended to ensure that kids on Medicaid in New York will have access to timely, intensive mental health services in their local community, as opposed to offering services solely in institutional settings. To discuss what the implementation of that agreement might look like, as well as to discuss the governor's budget proposal more broadly, we're joined in the Capitol Press Room by Assembly Mental Health Committee Chair Joanne Simon, a Brooklyn Democrat. Thanks for visiting us in the studio, Assembly Member.
Happy to be here.
So back in 2025, the state agreed to settle a 2022 lawsuit stemming from this lack of availability of community-based mental health services for that Medicaid-eligible population of kids, with an expectation that making these services more available would require higher reimbursement rates to providers to boost their capacity, as well as the adoption of a plan to improve the delivery of services. Let's take the first element of that equation. Is there money in this budget that you've seen so far or heard about that is going to address those Medicaid rates that are so critical to the capacity of these organizations?
I haven't seen it in this budget, right? It seems to, I think that the issue really is figuring out how much that is. We do need reimbursement rate increases. I think that the key element that's happening this year, and in fact it may include costs, but we don't have a sense of what those are, is this planning phase, right?
Sure.
This is 18 months of planning, really to completely shift and change the universe of the way we provide mental health services to children in New York State. So it's a massive kind of change, and it needs a lot of stakeholders. There's interagency issues, but also a lot of people who are part of that process engaging for a period of 18 months to ensure that what we then build is better than what we had, and that actually meets the needs and the requirements that are set out in that settlement agreement.
Well, it sounds like that 18-month timeline that the Mental Health Commissioner Ann Sullivan laid out during her budget testimony makes sense to you, because to me, when I heard that and the idea of needing a year and a half to engage stakeholders, even for something of this comprehensive in nature, when we're talking about these coordination plans, seemed like a pretty long runway, but it makes sense to you?
Yes.
Okay.
First of all, you're talking about the state, and you're talking about phenomenally different needs. You know, we talked today about transportation for elderly people, for veterans, et cetera. You know, when it comes to providing mental health services, if people can't get from here to there, they're not going to see anybody. Right? So you look at different parts of the state and the models used for upstate that assume certain things. The North Country keeps saying they have a very different world than much of upstate, for example. New York City is totally different, although just because we have public transit doesn't mean you can get there from here, depending on where you live.
Sure.
Right? So it is a complicated issue. There are so many things around mental health and children, and this whole issue of Medicaid funding, right? Another big issue that's we don't know. But the reality is that you can't create a better system unless you actually address the issues that have impacted the current system and made it so dysfunctional. There are lots of different agencies that have different pieces of this. And there are families who don't even understand what the problems are, how to get their child the help that they need, recognizing that they need help. There's an education system, the schools. You know, the schools want to help, but they don't necessarily have people who are trained to provide the kind of assistance that they need. So there's a whole world that needs to be engaged in a fundamentally different way. And so 18 months does not seem like a long time to me. It's a frustrating time because we're not providing the help that we need that much more quickly. But to do this the right way, I think you do need time.
And that time horizon then will also include, I believe, 2 to 3 years of implementation of a plan. So in the interim, is there anything that you think the state should be doing to try to get services to this population in those community-based settings, short of waiting for this plan to run its course?
Well, I think one of the things the commissioner said yesterday was that they were already beefing up provision of services locally. And if you look at sort of broadly what we're doing in mental health in New York State, is we're starting to move away from institutions, not the big deinstitutionalization of 50 years ago, but really looking at people with lived experience, people who are community-based providers that can actually serve people that much more effectively than, for example, being services being provided by big institutions that have longer waiting lists, that have more barriers, even if it's just the paperwork. This was an issue that came up in yesterday's hearing in another context, but it really is about a local group that, if somebody needs help, can help somebody get from one place to the other. They can pick them up and give them a ride. That's not going to happen if you call a hospital.
Sticking with that, ideas about barriers to access, we've heard from the governor and her teams how they're looking to cut so-called red tape. They're looking to remove regulatory burdens to accessing care. Did you hear anything, I'm guessing probably more likely from the providers and stakeholders than maybe the state people testifying, but did you hear anything about barriers that are being addressed in a meaningful way? Did anyone say, yep, we think this new licensure makes sense, or we think these new classes of certification make sense, or were people kind of a shoulder shrug emoji?
A little of both.
Okay.
I think that there are some barriers that are unintentional, right? There are just a lot of barriers that people don't realize are barriers. Sometimes it's filling out all the paperwork for people who are struggling with those issues. If you have somebody who's suffering from a substance abuse disorder, they may have a lot of cognitive impacts from their substance use. So it runs the gamut from those kinds of things to also just some process where you're vetting to make sure somebody's eligible and you have a long line of people, so it takes longer to do it. So that process becomes a barrier. So those things were identified, and that has came up yesterday in the conversations around the use of the opioid funds and where those dollars are going.
Sure.
And a real bias on the provider's side of actually providing them to people who are providing treatment. So there's that. There is a conversation about streamlining things. I think that's going to be part of what happens in this. The settlement is conversations about the child mental health care settlement process as well, because parents, if they can't get the help that their kids need because of these barriers, whether it's transportation, whether it's not being able to get off work, all of those kinds of things are going to be addressed in that process. So I think that that's an area that'll happen. The governor has brought it up in the area of housing, ways that you can streamline, for example, the aspects of the secret law, for example, that are it's 50 years old. Some of those things are problems in certain environments and not problems in others. In New York City, where I live, I have 40,000 new units of housing in my district in the last 8 years, right? So I don't have the problem of single-family residence being built on a plot of 2 acres. I don't have 2 acres in my district,
Sure.
right? So those things look differently. And so when you're looking at a state law, some of those aspects of the law need to be tightened up, but are going to have very little, if any, impact on other parts of the state where that's not the dynamic anyway.
Sure.
And so we're looking at those things and what it is that the governor is actually proposing. And I know that there are some other, there's another bill out there that would do some of those same things, but some additional aspects. So streamlining is a good thing, because where we can't get people the help they need, whether it's they can't get the housing they need, whether it's they can't get the supported housing they need, that's an area with a lot of barriers. You have population that is struggling under the consequences of their mental illness, for example, or their developmental disability, or the senior who's frightened, right, to get supported housing. And there are a lot of hoops. But we also have several funding streams for supported housing. And so they're all different. And one of the things the city has done, it was a city law passed, so they've done this, created a dashboard. We're just getting data on that. And we're finding out certain types of housing that are funded in certain ways that people get housing much more quickly than through other mechanisms.
Right. When it comes to those supportive housing units under the mental health umbrella,
exactly.
They're taking, I think, 175 days on average to be filled, whereas the ones under the Office of Addiction Services and Supports are filled at a much quicker rate.
Yes, and we have the ESHI housing versus the OMH housing and the different reimbursement, the different funding rates for those, which is another issue.
And just to explain that for listeners, there's these supportive housing programs that have been around for decades, and they're reimbursed at a much lower rate, even though they also provide usually more comprehensive services than some of the newer programs that get a much higher reimbursement rate.
Exactly. And the newer program is called eShy, and it's provides supported housing, but it's serving a population that is less in need, for example, in terms of additional services. And so why that is, I don't know. I don't know anybody has an answer for that.
Yeah, the mental health commissioner did not want to talk about it, and
I don't
just
think
seemed
she knows, right? And part of it is sometimes in the state, we've done something a certain way for years, and it's in this rut. And then we create a new program, and in the new program, we address issues that we know are a problem in the other program, but we don't actually address the first program because it just keeps going along,
Sure.
right? And so if you give 3% increase across the board, they're going to get 3% of less. And that's not bringing them up. So we really need to look at those kinds of issues going forward as well in this budget wherever we can, but certainly for future budgets, because this is the kind of situation that really can't sustain itself.
Yeah, the mental health commissioner, as it pertained to those older programs, did make the point that they were investing, I think, initial tens of millions of dollars into these supportive housing units, but it's still a far cry from what they need to be brought up to speed. So is that an area where you imagine the legislature is going to want to push back to some degree and maybe spend some additional capital?
Well, I certainly would like to. It's something that I will be advocating for. You know, one thing I've learned in New York City is that I think that the state provided some money a while back that's still in the city's coffers that hasn't been expended. But that made me be more trouble getting it out than not, right? So I'm not quite sure which way we're going to be able to address this issue, or perhaps both ways, right? Really putting pressure on the city to spend the money that is from, like the de Blasio administration, to fix these units and bring them up to code, make them safer, upgrade them in a way that are needed. But the landlords aren't going to make those repairs unless they're going to be paid for.
Another issue you flagged is this problem of the administration of behavioral health services to Medicaid patients, and specifically trying to get a carve-out from the managed care approach that was implemented both to save money and produce better outcomes, and by most metrics, it has not accomplished either of those goals. So do you have a sense of why the administration is so reluctant to do that carve-out, why they're so insistent on trying to promote Medicaid managed care for the behavioral health services?
I don't know. I think the original idea was that it would get people served more quickly, that there would be less, there's always an assumption, and there's always a possibility that this happens, that a fee-for-service model was spending money it didn't need to be spent, right? So the problem, of course, is that the people who are providing that Medicaid managed care are large corporations. They have profit margins.
Right, they're middlemen who need to take their cut.
Exactly, that are taking their cut. And they're not even New York corporations, right? But they're not easing up the provision of services. It's taking longer to get those services. And when you're talking about behavioral health, you have people in desperate need of support and treatment that they may not get for 6 months, and they could get in a month, or they could get in 2 weeks. We also find that, and the AG came out with a report about 2 years ago. Last year we addressed this issue with these ghost providers, right? So the lists that are provided, and you have to go through this routine, those places are not even there. Right? And so you're wasting time, you're spinning your wheels, you can't get through, and you don't even know that it's just running, the phone's ringing into a DMARC somewhere, right? So that's a problem as well. And it's all of these things are connected. And part of it is, I think, an assumption that people are trying to get away with something. There's always somebody who's going to try and get away with something. Those people are more likely to get away with it because they're trying to get away with it. But most people who need mental health support, right, just need the mental health support.
Sure.
And so by kind of questioning and assuming that there's something going on that shouldn't be, I think leads us to come up with these kinds of answers that are not really answering the problem.
Right, and we would think that something like the Office of Medicaid Inspector General could be the watchdog after the fact and maybe not need to gum up the system at the start. But lastly...
And we understand that the Office of Medicaid Administrator here is understanding this much differently. So I'm hopeful that we'll be able to make some change here.
Well, lastly, and this is on the insurance front and actually deals with a bill that you carry, you're looking to prevent discrimination by insurers based on an individual's mental health or substance use disorder. And this appears to be connected with the sort of issue of parity between these types of services and our physical health. But what does that mean to have sort of discrimination by insurers, and how are you looking to address it?
Well, we're looking to essentially close that gap. I mean, first of all, we're finding that federal law was passed. This was a big issue for years. It finally happened that federal law says you have to provide parity. In other words, you can't decide to provide less support for mental health treatment than for treatment for physical issues, and cut people off sooner, right? Or have a much higher deductible. It's another way of doing that. So federally now you can't do that. But the insurance companies in New York have not been doing it.
They've been
They've
creative.
been basically not following the law. So number one, they're not following the law. We want them to follow the law. We want to focus on that. But the other issue, of course, is that if there are additional rollbacks in federal law and a lack of funding in federal law, that we want to make sure that we make up that difference, that we require insurers to not only meet the federal standards, but if the federal standard changes, we want them to provide that parity under New York law, right? If you look at what's going on federally, they're changing things like the big ugly bill, under which they reclassified a group of fields as not being professionals, because then that would limit them getting federally guaranteed student loans.
Sure.
And that's things like audiologists. Like, since when is audiologists not a profession? Social workers, teachers. Makes no sense at all, but it does keep people from entering fields. What will happen is people won't go to college. They won't go into these fields because they can't get student loans. So with things like that happening, I don't know that they're not going to pull back on something like parity.
Well, we've been speaking with Assembly Mental Health Committee Chair Joanne Simon. She is a Brooklyn Democrat. Assembly member, thanks for visiting us in the studio.
Thanks for having me. I'm so glad to hear that you're interested in these issues.
Support for the Capitol Press Room comes from O'Donnell and Associates, a public affairs firm providing strategic guidance to businesses and nonprofits on navigating policy and regulatory issues. More information is available at o'donnellsolutions.com.